This Doctor Day, before posting or celebrating Happy Doctor's Day, ask these questions. Think and answer this question to yourself. What are the measures that can be implemented to reduce the incidence of violence against doctors in hospitals? How effective is the existing legislation in protecting healthcare professionals from the physical assaults by the patient's relatives? What are the social and psychological effects of workplace violence on doctors? How does overwork and understaffing affects the mental health of doctors, particularly in government hospitals? What are the long-term consequences of chronic burnout among healthcare professionals in India? Should there be limit on the number of working hours for doctors? Why is there is such a large pay gap between government doctors and those in the private hospitals? And how does it affect their morale? What impact has the increasing privatization on the healthcare had on working conditions of the doctors in India? How does rural urban disparity in healthcare facilities affect the motivation of doctors to serve in remote areas? Is the current medical negligence law fair to the doctors, or does it lead to undue harassment? How can we balance accountability with the protection against lawsuits in the medical profession? How has the spread of online misinformation has affected the doctor-patient relationship in India? Are rising patient expectations and the demands putting pressure on the doctors to overprescribe or overtreat? Why do many Indian doctors leave for foreign countries, and what can be done to retain the talent? How does the commercialization of medical education affect the quality and the ethics of the future doctors? What challenges do female doctors in India face in terms of work life balance and gender bias? How to prevent caste or religion based discrimination among medical students or professionals? How do poor infrastructure and lack of resources in rural hospitals impact the performance and the morale of the doctors? What role does poor quality implementation play in dissatisfaction among healthcare workers?